Hi, everyone, and welcome to the Community Outreach Program poster session. This is the very first week of events for National Volunteer Week, hosted by Source. We'll have events throughout the entire week, Monday through Friday, and I just dropped in the chat a link to our National Volunteer Week schedule of events. I want to thank all of our awesome Community Outreach Program nursing students for being with us today, and so many of your preceptors for joining us. We're thrilled to have this opportunity to have a discussion with all of you to learn about all the awesome things that have been happening with our Baltimore communities throughout this last academic year. And we'll also give any of our community preceptors a chance throughout the poster sessions to say a few comments as well. Again, this was a different year for us. This was the first year that we had to pivot to do completely virtual community engagement for this community outreach program. And that required our students as well as our community preceptors to be looking to pivot and work in a different way throughout this academic year. And I can say, having had conversations throughout the year with our nursing students, that y'all really showed up and worked to make an impact with our communities. And I've really enjoyed having this opportunity to have this time to work with all of you throughout the academic year. For those of you that don't know me, I'm Mindy Levin. I'm the founder and director of Source, and I have been coordinating the community outreach program for probably about 15 years. I'm going to have my colleague Leah say hello as well. Leah?
Hello, everyone. It's good to see so many of you could join us. I am Leah. I'm the program assistant this year. I'm a fifth semester master's entry into nursing program student. So graduating this May. It's been wonderful to be able to participate with all of you.
Thanks so much, Leah. So for any of you nursing students that are going to be here for next academic year, after we congratulate Leah on her graduation, I will be looking for a new COP program assistant for next year. So stay tuned as we share that announcement, and Leah's more than happy to talk with you if you're interested in the position. I do want to welcome and thank my colleagues for joining us. I see Ezat, Tony, Tyler. Let me look at the next screen. From our Source Center that are with us today. What we're going to do, we are going to have Leah in a moment here. She's going to start to share her screen. We will have the slide deck ready for our COP students. Each poster, which again, sometimes there's more than one student at a site. Each poster, you have about 3.5 to 4 minutes to present. If you have more than one slide, because a few of you do, just say next slide and Leah will advance the slide. I will be keeping track of the time, and I'll let you know. I'm literally just going to chime and say 30 seconds left if you hit the 3 minutes and 30-second mark. So you'll basically get to 4 minutes. And then I'll also have an opportunity, if a preceptor wants to say a quick comment, feel free to chime in after your student or students present their slide. And we'll be able to take any questions from the audience. I'm just trying to manage the time to keep us in. So we'll wrap up by 1:15 at the latest. So the other thing, Leah's starting to share the slides here. We'll also let you know that for the community outreach program presentation today, we're going to give all of you, every single person in this audience today, whether you are a student, a community preceptor, somebody that's just viewing, or a member of one of our teams, an opportunity to vote. Leah, if you go to the next slide, please. So for the voting today, we're going to have kind of like a live poll at the very end. You'll be able to submit a vote for 3 different categories. Which of our posters gave the best description of the work that they did throughout the community outreach program? Which poster was the most artistic, and then the overall fan favorite. So everyone will have an opportunity to give a vote at the very end, and we have all of our posters listed on the poll, so you'll have more information as we follow from there. Next slide, please. So we're going to jump right in. I'm going to have our colleagues, students from Commodore, start off. If y'all want to unmute yourselves and show yourselves on the video, we'll turn it over to you, and I will get the timer going.
Hi, how are you guys? I'm Elizabeth, and my colleague that I worked with is Megan Shirley. And so, as you guys can see, we're going to win for artistic creativity. I'm very technologically challenged slash don't have much artistic creativity skills, so forgive us. But our that's not to say that we weren't very creative with our virtual lessons. So what we did, we worked with Commodore John Rogers Elementary School with the pre-K and first grade students. And so because it was all virtual, we created pre-recorded. Originally, we started out creating pre-recorded lessons. And so the goal of each lesson was we'd start out with a very elementary lesson or just basic concepts that we thought that they could grasp, and then would end it with a an engaging activity to help them more easily understand the lesson using tactile skills usually, because that age group more easily understands concepts through that mechanism of learning. So although they were very basic lessons, the ultimate goal was to create a foundation of understanding that they could build upon and just be aware of certain health concepts. And some again were things that they could apply easily, like for instance COVID, wearing a mask, hand washing, while others were um, a bit harder to apply, like emotions for instance. But we wanted to address concepts like that so that they were aware of their emotions and how to respond to them. And again, some things were in their control and other things weren't. So emotions, for instance, is an um, individual health concept that they could work on and try to become aware of and more familiar with, whereas food or nutrition may be out of their control, but at least they have some sort of awareness of that impact on their health. So yeah, so even though they were basic concepts, I think it's important at that age level just to create a familiarity uh, with health in general. So yeah, that was our community outreach program. And oh, towards the end, I should say we did get to engage with the students online. So we joined in with the Zoom classes, which was easier because we got that response from the students. Whereas when we were submitting the videos, we didn't necessarily get an immediate response. Um, yeah, Megan, do you have anything else to add?
Sure. So I'll just go over the learning outcomes for us. So as a student, it benefited us in the following ways. We were fortunate enough to practice our teaching techniques, our pediatric experiences in simplifying complex lessons. So like for us as students, what's complex for us, really just breaking it down into basic concepts, obviously to field to the kids, and creatively presenting materials like health material in a fun, engaging way, which is a huge one. And then
30
hopefully,
seconds left, Megan.
oh, sure, being impactful for the students. They got educated on hygiene techniques, basic and simple overviews, and they had their first experience with health, which we hope, I guess, ultimately would build them for the future. So maybe that would spark their interest in healthcare topics. Thank you.
Awesome. Elizabeth and Megan, thank you both so much for sharing. I did see Hannah, your preceptor from Commodore John Rogers, log in. Hannah, I didn't know if you wanted to say anything or not. So I'll just ask a quick question. I think Elizabeth alluded to it potentially. I know at the beginning you were doing like creating those videos. How did it feel when you were actually doing those live Zoom sessions with the students? What kind of feedback were you receiving?
Oh, it was awesome because to have that interaction with the students and to gauge their understanding immediately and was a lot more a lot easier for us, I think, than just doing a pre-recorded lesson and kind of going in the dark with it. But what would you say, Megan?
So I was surprised. So they actually asked a lot of questions, like applicable questions. For example, like we did I did a cardio one, and they asked, blood flow, and they asked about like arteries and capillaries. So you know what I mean? Like they asked like actual question. One asked me where red blood cells were made. One student thought I was a vet, which like kind of concerns me. You know what I mean? Just like in general, because I was definitely teaching, for people and for the students, but they were just fun, and the age group was really great. You see on there, it was approximately 100 students, and we were broken down into pre-K, K, and then first grade. And me and Lizzie alternated weeks, so that's how that was organized.
Yeah, I would say once I started speaking with them in class, I realized that their understanding was a lot more advanced than I anticipated. So, which was interesting. Like they would ask questions and engage in a way that I wasn't expecting necessarily. So that was kind of fun.
Great. Well, thank you both so much. We are going to transition to the next poster for the Esperanza Center. So Leah, if you could advance the slide. And Stacy and Alejandra, if you want to unmute yourselves and go ahead and tell us about your work.
Hi everyone, my name is Stacy and I worked at the Esperanza Center with Alejandra. And a little bit of history about the Esperanza Center. It started in the 1960s after Nancy Conrad returned to Baltimore after serving alongside young Christian workers in Latin America. And she recognized the barriers recent immigrants had to endure in the Baltimore city. So she decided to make a change. And Esperanza Center actually began in a classroom in the first floor of the St. Anne's School and has now grown to what it is today. So the mission of Esperanza Center is to welcome immigrants by offering hope, compassionate services, and the power to improve their lives. And they provide several services such as free healthcare, education. So they provide classes to teach people how to speak English, immigration legal services, and referrals to community services. Alejandra and I were part of the COVID-19 hotline. It was a Spanish hotline, and we took calls from callers, and we had questions in all areas. Sometimes we would help people and refer them to like eviction, prevention, referrals, or food sources. The hotline predominantly served people that were only our Spanish-speaking undocumented people who were impacted greatly by COVID-19. And during our time as the hotline workers, we enrolled callers to get COVID testing at the Sagrado Corazon Church in Highlandtown, and more recently through Johns Hopkins. And we were also allocated about 150 vaccines a week to provide to the undocumented community, which I think is really amazing. So we do that at the Sagrado Corazon, and more recently we have progressed to now schedule at the Convention Center and the University of Baltimore, Maryland. Next slide.
So the learning outcomes that we had were the importance of empathetic and therapeutic communication during these screenings. Often establishing rapport was very important because if you did that, then some clients might disclose that they were having some difficulties in other areas that you could then make referrals to. And there was some learning for me, especially with difficulties faced by the undocumented immigrant population. These have often been exacerbated by the pandemic, which has made employment issues worse. Then there can be housing instability or like renting from like subletting instead of renting. So evictions can become a lot more common. Employment options can be limited despite previous education. And then often can be unable to pay for healthcare services, which is why the healthcare services that the Esperanza Clinic provides can be so helpful. And often translation services would be necessary, and that question would come up when we were sort of directing them to their vaccination sites, they were tended to be concerned about whether or not there would be somebody present that would be able to communicate with them properly. Then I also learned about the importance of teamwork and coordination in order for the entire team to offer full range of services to those eligible and in need, just because the services that we were offering would vary from week to week, whether or not we would get a grant to get the program that Stacey talked about, ARIF extended. And that program was specifically in order to give families impacted by COVID a sort of a one-time debit card grant so that they would be able to pay for their needs in that time.
30 seconds left.
Okay, sorry. So then moving on to impact on community partner. So we were helping to provide resources and help to the most vulnerable populations and provided monetary assistance to 22 families and 15 individuals through that ARIF program. And 1,238 vaccines have been administered so far. And accessible COVID-19 testing has been available for the community at Sacred Heart and at Hopkins Hospital.
Great. Thank you both so much. I see that Samantha's on the line, your preceptor from the Esperanza Center. Didn't know if you wanted to say any words about your experience working with our colleagues.
Sure. So I have been so thankful to have Alejandra and Stacey on our team this year, and I know that the rest of the team feels the same. They have really just been so dedicated to this project and so invested in our clients, and obviously such a great asset that they speak Spanish, and they have been really flexible as things have changed seemingly every week or every month about the exact activities that we were doing. And so their ability to just kind of take on new tasks and learn new tasks has been really admirable. And I'm really glad that they're in this career path because they're going to do great things.
Thank you so much for sharing that. Yes, this was obviously a new project this year, having this Spanish-speaking COVID-19 hotline. So we really valued this opportunity. It worked out well. Thank you both.
Thank you.
Awesome. So we're going to move on to the next poster, which is from, we had 2 COP students were with Free State Justice this year.
Hello, my name is Deanna, and I was working with Free State Justice this semester along with Cameron. So Free State Justice provides legal services, policy, and advocacy support and training for LGBT issues in Maryland and nationwide. And that's also the Free State Justice's mission statement posted up there. So Free State Justice main legal services are name changes, gender marker changes, legal protections from harassment, family law, and also discrimination cases. And Free State also works with Maryland state legislators to advocate for diverse, equitable, and inclusive legislation pertaining to the LGBT community. Next slide.
So for the community engagement aspect that Free State Justice provides and Deanna and myself helped with, we helped with improving the intake forms for Free State Justice clients, helped research new tools to improve communication between the clients, donors, and Free State Justice, as well as helped host a weekly policy forum to inform the community about relevant LGBTQ policy for this year's Maryland General Assembly. I would say for our student outcomes between Deanna and myself, we were able to acquire new experience in state policy, including tracking and writing briefs. We learned about the nuances of live streaming for social media, and most importantly, gained a deeper understanding of legal barriers for the LGBTQ community. Next slide. So for impact on partner, between Deanna and myself, we were able to help assist and facilitate document management for intake of clients. Deanna, I know, provided over 20+ hours of data management earlier this year. We were able to help host over 4 live stream weekly policy forums, informing the community about the Maryland General Assembly. And then we also aided in tracking and managing bills throughout the Maryland General Assembly. Thank you.
Thank you both so much. I think I saw Jeremy from Free State Justice on the call. Jeremy, if you wanted to say hello and anything about your work with Deanna and Cameron.
Yes, hello everyone. I will just wanted to kind of publicly thank Deanna and Cameron for their work throughout their time with us. I know, even the data management piece that you all talked a little bit about, I think Deanna, your work in really kind of doing an inventory of the different, data pieces we're connecting, on what forms are feeding into what data points, really just being able to set us up with a good kind of grasp, like big picture view has been extremely helpful. And, for me, the kind of exciting part is we're already seeing through source actually, other folks kind of come in, step in and really take the work that you did and sort of, begin to analyze and, provide additional recommendations on our outcomes tracking. And so I just, that value is already being realized for us. And then, Cameron, I think as well, you definitely were extremely helpful as we were experimenting with a lot of different new technologies. Now that we sort of have moved or sort of adapted to this virtual environment, we were used to doing more in-person, like lobbying and, having like a virtual lobby, having an in-person lobby day and doing a lot of things in person. And so when we were having, as the General Assembly had to shift to virtual, it was really helpful to have you kind of guide us through how to go about doing streaming and still connect with folks across the state, despite these changes. So it definitely very, very helpful, in a lot of our work and delivery. So.
Thanks, Jeremy. And thanks to both of you. We really enjoyed hearing about the work that you've done with Free State Justice this year. Lee, I'm going to have you go to the next slide, and we're going to turn it over to the team of COP students that we're working with Gilchrist Hospice Care.
Okay, hey guys, my name is Mindy, and I worked with Ashley. Ashley, are you here?
I'm here.
Okay. So we work with Gilchrist Hospice Care. The goal of the volunteers is to provide care and emotional support for either the patient themselves or their caregivers. The goal of this is to provide happiness and a high quality care for Baltimore residents who are nearing the end of their life. Now, this is not just pertaining to geriatric patients, but sometimes there are some middle-aged adult groups and pediatrics as well.
Okay, so some of the things we learned through this program, I'm just going to go through the list. Even the small things count, like routine phone calls, which is what our job as volunteers is. You should approach with empathy, even if you don't have experience with a loved one going through hospice care. Hospice care is about improving quality of life. Hospice graduation is when patients become healthy enough to leave hospice care. So not, sorry, let me. Not every patient's experience with hospice care ends with like death. Sometimes they actually improve enough to the point where they can go back to regular life without hospice care. And that's the goal of hospice care, is that you improve the person's quality of life to the point where their physical health actually improves. Like Mindy said, there's pediatric and adult clients. And then also we provide support to caregivers. In fact, most of the time we provide support to the caregivers over the patient, because caregivers are often very overwhelmed with all the tasks they have to do and need some sort of support, emotional support. In a normal world where there isn't COVID, volunteers are supposed to come in and like help with little things like do the dishes, be a friend to them, I don't know, watch TV with them, just anything and everything that would help. During COVID, unfortunately, we've been restricted to phone calls, which in my experience has seemed to kind of make the caregivers just feel more overwhelmed. But Mindy and I are both in the process of getting more and more patients every week. So yeah, I think that's all I have to say.
Okay, thank you, Mindy and Ashley. I did see both Lindsay and Jane from Gilchrist Hospice on the call. If either one of you wanted to say a few words.
Yeah, so I'd like to say to all of you, we appreciate so much the time that Ashley and Mindy dedicated in their training. The training is very all-consuming. It was about 20 hours, and I hope that they learned a great deal in that. part of the problem that hospice has is just in educating people on what hospice really means, and actually touched on that a little bit. But it's not just death, it's about how to live your very best last days. I do apologize on our part for all of the computer and technology problems we had. They didn't get nearly as much experience as we had hoped between a ransomware attack and background issues. It just took forever to get to them. But I hope, if nothing else, they've learned a lot through the training, and I know that Mindy plans to use some of what she's learned in her platform in the Miss Maryland competition. So I hope that you all will continue to share your knowledge with others.
Thank you, Jane. I think that's a testament to like real world stuff, right? So for folks that don't know, Jane kind of alluded to it. Gilchrist had a ransomware attack, and that happens in the real world. It has happened at places, and it put some pause in there. Lindsay, I thought you were about to unmute. I didn't want to cut you off.
Yeah, no, I just wanted, to say thank you to Ashley and Mindy. Like, I second what Jane said. We went through some big challenges technologically, which pushed things back a little bit. And, both have been right there with us, just, like everyone else, waiting to get started. And, the calls that are being done are, like Ashley said, to caregivers of hospice patients. And they do seem overwhelmed a lot. I mean, they have a lot going on, and sometimes they're receptive to those calls, and sometimes they're not. But every, moment that is given from our volunteers is truly appreciated. And, they may not always seem, or they may seem overwhelmed and may not always seem receptive to the calls. But later on, we often hear, thank that volunteer for calling me. I just had a lot going on, and it might be the wrong time sometimes when you reach them. So we always tell people, keep your hopes up. The connections will be made, and the calls are very, very important to us, to the families, to the clinical teams. And so hopefully we'll get some more for these ladies.
Awesome. Thank you all so much. Again, the big training, but there's a lot of important work that goes on with hospice care. We're going to transition to our next poster, which is the team that was working with Henderson Hopkins.
Hi, so we unfortunately don't have one of our team members here, but me and Olivia will speak about Henderson Hopkins. So Henderson Hopkins is a Johns Hopkins University K-8 partnership school that serves a diverse community of Baltimore, and they strive to unleash students' joy and passion while preparing them for academic success and fulfillment in a rapidly changing world. And in our partnership with Henderson Hopkins, we try to work with the students that the school serves and their parents as well. So one of the programs we did was Read for Health, which is a SNAP Ed program, and we used language arts as a method to teach nutrition and encourage physical activity and healthy eating to children. And unfortunately, due to COVID, we had to teach these lessons every third Friday of the month in a virtual format, which was interesting, but we tried our best and made it work. And we're still continuing that currently. And Ask a Nurse, we're currently trying to make that an app as well. Dr. Francis is in the process of that. And it's offered as a telephone service for the families of Henderson Hopkins. And they can really ask about any health concerns that they have, and we can give them the proper resources we have through flyers and banners as well. And virtual health fair, we wanted to engage parents of the Henderson Hopkins students, along with collaboration with House of Ruth and the Wald Center, to create this virtual health fair to educate these members about their health and wellness. And we included community leaders and professionals, but unfortunately, just due to constraints with registration, we try to now just send them 5-minute lessons about health and wellness instead of having a virtual health fair, which was supposed to occur this last Saturday. Next slide, please.
So for our student learning outcomes, we learned how valuable it can be able to educate, teach parents and kids, the community about health topics.
So specifically with COVID-19. And then we also realized that like a lot of people, including members of the Baltimore community, are not being provided with educational resources and information about health topics, especially with COVID-19. So being able to provide and put together like PowerPoints with information was beneficial to the community. We also learned about the importance of educating school-aged children about healthy eating and nutrition through Read for Health. And that's important because schools like play an important role in helping students establish healthy eating behaviors. So when school-age children are consistently like being shown accurate messages about good nutrition and being asked to apply these behaviors to like their own lives, it will help them understand why nutrition is so important as they move throughout their lives. And then we also learned like how we can do so much community outreach and education, even in a virtual setting. And I think everyone knows like how difficult this last year was for many people. But it really proved that we can still provide the same community outreach and education, even in a virtual setting, and finding those different ways to provide the resources to community members. And then finally, for the impact on our community partner, most of this has been mentioned, but we helped to create a COVID-19 presentation for Health Education Task Force that had several topics of conversation surrounding COVID-19 and questions dealing with COVID-19 in schools. For instance, like, can COVID-19 stay on backpacks, or what should you do to maintain social distancing in schools? And what types of face masks are the most effective, just to name a
30
couple
seconds
of
left,
them.
Olivia.
And then we also mentioned this as well, but we assisted with nutrition education with the students through Read for Health virtually to help promote better nutrition and healthy options. And we provided resources and tools to the community of Baltimore about specific health topics, which were posted to the community website. And that's it. Thank you.
Great. Thank you both so much. I did see Dr. Lucine Francis, your preceptor, on the call. Lucine, if you want to say anything.
Yeah, sure. Thank you, Alicia, Olivia, and also Allah, who couldn't make it. I just want to thank you for a job well done. When schools closed in March, I quite honestly, I didn't know how we were going to continue our health and wellness activities in the school, because everything that we were doing was in person. But when you guys came along and we had this opportunity, along with the University of Maryland, partnering with the University of Maryland to implement this Read for Health, it was so great to have Alicia take the lead on that, and for Allah and Olivia to participate, do the training online, spent some significant time doing training around the curriculum. It was also helpful that the students had some type of nutrition education background to implement Read for Health. So I am just in awe of how much that you all were able to accomplish during COVID-19, when I didn't think that, much would be happening. Also, the virtual health fair, this is a learning opportunity for all of us. When things don't pan out, that's information, right? It could be the fact that families have digital fatigue and they can't see themselves doing a 3-hour virtual health fair. It could be technical difficulties in terms of registration. You see how important it is to have, sound registration for people to register for an event. Whatever it may be, don't consider it as a failure. This is just an opportunity for you to learn and build on it and continue. So challenges are always great. And when you're doing community-based work, things work out and things do not work out. Thank you for the Ask a Nurse, helping to develop that protocol and guideline, and we're still working on it. And I'm just in awe with all of the things that you guys were able to do. You were flexible. When I said, okay, we're not working on the virtual health, we got to work on this now, you guys were able to pivot and do what needed to be done. So I just want to thank you all for being able to pivot when needed.
Awesome. Thank you so much. I think some great words of wisdom there, because I think we all did have to learn how to be extremely flexible in this setting and shift whenever we needed to shift. So thank you for your work there. We're going to move on to the next slide. We're going to be hearing from the team at House of Ruth, Maryland.
Hi, my name is Jen, and I worked with Emily at the House of Ruth. House of Ruth is a comprehensive community resource for women and children experiencing domestic and intimate partner violence. They provide shelter for individuals and families, daycare for children, safety planning, and referrals to other community resources. One of our main focuses there was creating an updated COVID-19 informational resources, which included handouts, flyers, and making some presentations. Recently, we've been focused on providing information about the vaccines. We created a voiceover presentation and some accompanying handouts that included background on the vaccine, who could and should get the vaccine at certain time points, and information about how to sign up for appointments. And we also included some information that was of specific interest to the clients at the shelter, such as if you should get the vaccine if you're pregnant or breastfeeding, which for the most part you should. The presentation was given virtually to clients at the House of Ruth, and the resources were shared with the CCIAS team to be included in their COVID-19 vaccine resource packet that was distributed to other groups in the community. Our learning outcomes for this project were that we ourselves learned a lot about the COVID-19 vaccines and the challenges associated with getting vaccine appointments, and with that, the source of a lot of the disparities we're seeing with the vaccine distribution. And our impact on the community, we were really happy that it was able to be shared with people outside of the House of Ruth. That was kind of cool. And we were also able to provide accurate, up-to-date information for shelter clients and staff, and hopefully helped some people get vaccine appointments by providing that guidance. And Emily's going to talk about some of the other things we did there.
Yeah, so aside from the COVID vaccine PowerPoint, some of the other projects that we completed for House of Ruth, we're creating some health education materials for the health suite. So they used these flyers that we made to post around the shelter and to provide to the residents. So these were just about illnesses and things that were most relevant to individuals living in a, close quarters like a shelter. So for example, we made a handout about getting the flu vaccine, hand, foot, and mouth disease, dental emergencies, and then we also made a pamphlet about how to apply for health insurance. One of the other things that we do frequently is perform client intakes. So when a new resident comes to the shelter, our nurses in the health suite perform an intake just to make sure that we have identified all of their health and kind of social work needs. So we help out with those, and they're intended to identify immediate health needs and also what referrals we'll need to make. So some things that we learned from our interactions with the shelter and its residents are first therapeutic communication skills, because these are individuals who have experienced a lot of trauma. And we have learned kind of how to ask them questions in a sensitive way and how to do the history taking in a sensitive way.
30 seconds left, Emily.
Okay. Also just how to navigate resources and advocate for clients as it relates to their health, the intricacies of health insurance and how to apply, who's eligible, the complex nature of intimate partner violence and how to be sensitive to individuals who have experienced trauma, and information about common illnesses. And our work benefited House of Ruth by providing them with new and updated educational materials. We helped to provide a better understanding of health insurance eligibility, especially for undocumented residents. And we also helped to better manage client health needs.
Awesome. Thank you both for your great work at House of Ruth. Just looking to see if we have any of preceptors on the call. Oh, Trinon, you were working with them, right? Sorry.
I think they're doing I'm really grateful to have Jen and Emily to work with us at House of Ruth. So first of all, I think the COVID vaccination presentation voiceover is amazing. It's like comprehensive presentation, and it helped us to have a really great conversation with individuals in the Health of Ruth. And we ended up having some clients sign up on site, and then like they got their vaccination the second day we had the presentation. So that's really a great start to have a conversation with the residents in the shelters. So we're really thankful for that. And the other thing is that they really, Jen and Emily really provides like great resource list based on individual needs. And like for us, like we're nurses working on the shelter, like everything could happen. Like everyone has different needs, and then we just turn to them, asking them if they can provide us with something else, and then they can like turn it back to us. So that's really amazing to have them to work with us there. Thank you.
Awesome. Thank you all for your great work with House of Ruth this year. We're going to transition to the next slide. We're going to be hearing from some of our COP students that we're working with Jubilee Arts.
Hi, everyone. Mariah and I had the pleasure of working with Jubilee Arts over the last couple months. And Jubilee Arts is a community program that is bringing art back to the surrounding neighborhood, Baltimore, Maryland. And it provides a variety of art classes to the residents of the neighborhood. And some of the class offerings are dance classes, like African dance, hip hop. There's visual arts classes, like recycle art classes and draw along classes and creative writing, and also ceramics. Jubilee works in partnership with the Maryland Institute College of Art, Baltimore Clayworks, area artists, writers, and dancers to provide all of its classes to the students. Some of the things that I've been assisting with are helping out with the Zoom art and dance classes each week. I personally work with the Draw Along, Recycle Art, and Magazine class instructors, and I help with technical issues on Zoom and helping to encourage the students to participate and to share their work in a safe space. And I also help out with administrative tasks like making outreach calls and reminder calls about classes that are being offered. Next slide.
Hello, my name's Mariah. Some student learning outcomes that we did was just being able to appreciate the importance of art, especially at a time like this with COVID. These art classes help keep the children in the community more engaged, helps them meet other students that have similar interests, as well as teaching them ways to like cope with stress and isolation. We also, some things that I did was being a host for these art classes helped us communicate and build rapport with the younger population than we're normally used to. We got better at navigating Zooms and using all of its functions. Aside from art classes, I had the opportunity to tutor high school students, like breaking down complex subjects to more simpler terms that they understand. And some subjects that I tutored in was in chemistry, algebra, and geometry, which helped strengthen their knowledge, boost their confidence, and build important learning skills that they can carry on with them. The impact on the community, Jubilee Arts provides a safe space for students to learn and grow in their art and academically. Teaching the community that art improves social well-being, encouraging expression, and creates a sense of pride that is inspired and reflects the community. Jubilee Arts is not only nourishing their students and staff, but they are beautifying the community through the form of art. And that's all. Thank you.
Great. Thank you both so much. I did see Nora on the call, who's been your preceptor. Nora, if you wanted to say anything.
Hello, everyone. Thank you so much to Mariah and Lerna. You've just been wonderful, and I just can't tell you how much it means to me to have reliable volunteers that I can count on to keep things consistent. It's so important that the youth and the artists just know we're going to be there every week, especially in uncertain times. So I just thank you all for being on it, always on top of everything, and it just helps everything run smoother, and it really supports the staff in managing all of our many things. So thank you to you both. We're grateful. And to the COP program over years of helping us. Thank you.
It's reciprocal. We love to have this partnership with you. Thank you so much. Great job, everyone. We're going to transition now to, we had two folks that were at the Light of Truth Center.
Hey everybody, I'm Gabriella and I'm here with my colleague Jessica, and I also see Reverend Vale here. We're so happy to see you. Okay, so Light of Truth Center is a nonprofit residential and outpatient therapeutic treatment program serving women recovering from substance use disorders. And a little bit of history about that, Reverend Vale saw the need to provide a clean, safe space for women recovering when she visited a peer who was recovering and saw that the place where she was residing was unfit for someone who was trying to live a better lifestyle and recover peacefully. So Light of Truth Center provides safe, clean housing, case management, peer groups, mostly 12-step programs like AA and NA, recovery tool application workshops, relapse prevention workshops, education for families, aftercare relapse prevention programs, and life development planning, all along with an incredibly caring and therapeutic environment for women to recover. And one of the many core beliefs that Light of Truth Center has is that recovery is possible and every woman has the right to recover. Next page, please. Awesome. So some of the community engagement activities we did, we divided it into like 3 parts. So the first one is that we created, with the help of LTC staff, a brochure for new residents, highlighting concepts in self-advocacy, medication management, and also a corresponding PowerPoint presentation. Being at Hopkins, we do have access to incredible resources and also staff. So it was just very helpful to be able to have all those resources and create a more streamlined way to be able to help residents find self-advocacy and ways to manage their medications. We also directed volunteers to free and reliable information about specific meds used to treat substance use disorders and common co-occurring conditions. And we are currently corresponding with Light of Truth Center members and addiction specialists at Johns Hopkins Medicine to be able to kind of bridge that gap between the clinical side of recovery and the treatment side of recovery and see where we can bridge those gaps. And now Jessica.
Yeah, so then for the student learning outcomes, we got a clear understanding of the different types of interventions used for substance use disorder. We also got to firsthand experience the difficulties that the women at the Light of Truth Center had in communicating with their providers. So we always learn about clear communication in class, and we got to see why that's important. And we also saw the empathy, patience and love that LTC provides to the women. It's such a caring and loving place. And then the impact on the community partner, we gave them resources to help the staff and the patients advocate for themselves. We also gave them a better understanding of medications, conditions, and self-advocacy techniques. And shout out to Reni Nakamoto. She wasn't in COP for Light of Truth, like volunteering with COP, but she was volunteering on the side with LTC, and she was helping the residents transition into self-managing their medications.
About 20 seconds, Jessica.
Okay, and then if we go to the next slide, you can see that we had the brochure and then also the presentation.
Awesome. Thank you both, and to Rennie as well. And Reverend Val Leonard is on the line. Val, if you wanted to say anything.
I certainly do. I just want to say, wow. It is amazing what they have created. And this is something that's going to be used not just once, but it becomes a part of our orientation process. We're redeveloping and redesigning our website, and this will be a part of the new website so that it will be, continuous. We'll be using this continuously. But one of the things that I'm so amazed when I listen to both of them speak is that they got it. They heard us, and they were really able to grasp what we were looking for. They came in right in the middle of us being CARF accredited. So they were able to kind of take their marching orders and just go off and actually create what we have asked for. I want both of you to know that you have exceeded my expectations. And I hope you understand how important this is. Because women, as they come through the program, they're growing. But one thing that they don't know how to do is advocate for themselves. This is critical, especially when it comes to medication. There's certain areas that we can't step into, certain things that we cannot say to their medical providers, but you've given them a tool and a way to understand their medication, its impact, and how they can stand up and advocate for themselves. I can't tell you how wonderful that is. I hope you really understand and grasp what you have not only done for our participants, but what you've done for the organization. We were able to present this information to CARF doing our accreditation, and they were overwhelmed. It ended up being one of our strengths. So thank you, thank you, thank you.
Thank you for those beautiful words, Val, and congratulations to all of you for your work at Light of Truth Center. Leah, we're going to go to the next slide. We're going to hear from Jessica, who was working with Project Place.
That's a tough act to follow. Nice job, Gavin and Jessica. Yeah, so I worked at Project Place this semester, which is a shelter for folks lacking ample housing and employment. And they provide both temporary housing services as well as permanent housing, as well as support services. And so it was really interesting working with this organization because it was much more than, just a homeless shelter, but rather providing a variety of different services to really empower each individual to function at the highest level possible. So, how do we offer things to help people become more independent and ultimately, go on to lead independent lives. So their vision to eliminate homelessness, I really saw that reflected throughout my work there. And the population that they served are those that are the most vulnerable and underserved homeless adults here in Baltimore City, including both adults and families, including those with mental illness, HIV/AIDS, addiction, developmental disabilities, and ex-offenders. They also serve a lot of veterans, and they actually have some services for veterans and other folks in Baltimore County as well. So very big impact in Baltimore and the surrounding areas. Next slide, please. So my main function there was working on their Education to Independence Health workshops. And I actually got the opportunity to work with the Source Service Scholar from the School of Public Health. And that was a really great experience. I feel like I don't have a ton of opportunities to network and work with folks from the other schools. So that was really, really nice. And she was great to work with. But the goals of the program were really to kind of like what I mentioned before, but to ensure clients are on a path to sustained medical independence. We're looking to improve clients' ability to prevent chronic disease, understand and manage any chronic diseases that they already have. And, by doing so, we're hoping to see longer term outcomes, both for the clients, but also in reducing emergency room visits and things like that. And it's cool because I'm more of working on the content development for the program, but Kelsey's doing a lot, the Source Service Scholar is doing a lot around research and focus groups and figuring out how impactful the program is. So that part, the evaluation, and that's the word I'm looking for. That part's pretty cool as well. So some of the topics that we covered: PTSD, personal wellness, the COVID vaccine, substance use disorder, and we're working on a workshop around coping strategies. And we've actually been able to connect with some guest speakers from AA to facilitate some a part of that workshop as well, which has been cool. So as far as the student learning outcomes, when I going into this, I thought that with, when you think of health education, I thought, chronic disease like hypertension, diabetes, and while they did cover those previously, a lot of what I ended up focusing on during my time were mental health conditions. So, really in order to like be a full functioning individual, you have to really be able to manage both your mental health and your physical conditions. And they can't be like in silos. You really have to be on top of both. So I learned a lot about, I took one psych class and then I'm diving into this content. So that was really interesting. Also, Mindy actually mentioned this in one of her breakout rooms, but the individuals are actually the experts. So the ones that are experiencing chronic disease, chronic illness are the experts. So what I mean by that is like when we go in and do these workshops, like I really try not to come off as like, I'm from Hopkins, like, let me tell you about the disease that like you have, but instead we really try to make them interactive and offer opportunities for folks to share their experiences and really educate us too about what it's like living with these chronic illnesses. So that was definitely a great experience for me just to hear from people. And they're also
That's about 20 seconds left.
Very, very open to sharing their experience as well. I think, I kind of talked about what the impact was. We're doing these workshops, but one big takeaway that like I had in this whole opportunity was leveraging connections like through my school that I met. And like, I've only lived here for a year and I didn't even really like think I like had many connections, but I was able to reach out to speakers or folks that have like done things in my program and got them to speak at Project Place, or like asked a colleague who is really interested in mental health to lead a presentation. So that was really nice. It made me feel like I actually had more connections than I thought. So anyways, it was an awesome experience. And if any of you have like any free time, which I know you don't, but strongly recommend like volunteering with this organization because they're great.
Awesome. Thank you so much, Jessica. I know Jordan wasn't able to make it today, but I'm sure she would pass along all of the praise and congratulations for the work that you've done with Project Play. So I'll just say that on her behalf. And thanks for being there. I'm glad that you had the opportunity to have an interprofessional experience working with our colleagues from public health as well. Well done, Jessica.
Thank you.
You're welcome. All right, so next we're going to go to the next poster from the Spark Women's Center.
Hi, my name's Sam, and I work.
Rennie.
Yeah, sorry, Rennie. I worked with Rennie, and we were at Spark Women's Center. So Spark stands for Sex Workers Promoting Action, Risk Reduction, and Community Mobilization. And they provided, prior to COVID, a full drop-in center and mobile clinic for non-male identifying individuals. And then throughout COVID, they provided a drop-off service for syringe exchange and other overdose prevention materials. And they're actually going to be opening back up, I think partially in June. So their mission is to enhance the well-being of women who sell sex by providing safe and compassionate health, social, and legal services at no cost. And they do this all through a harm reduction lens, which is a huge part of the organization. So some of the things that we did during our work with Spark, we created social media posts and pamphlets, a couple of which are shown here on the slide. We created some regarding the flu, COVID, the COVID vaccine, and hepatitis C. And then we worked with the Baltimore City Health Department to help connect some of the other local community partners with a mobile vaccine clinic that they were doing. And we also helped analyze some syringe distribution data that the organization had built up over the past year. Next slide, please.
So in terms of what Sam and I have learned from working with Spark, number one is the importance of connecting with the community. And although we weren't able to be physically present working with their target population, we really saw how connecting with clients during their meetings really emphasizes a lot of purpose around their mission statement and what they're doing in all their work.
just having that establishment with their clients. Number two, reinforcing the idea that we should treat all persons with dignity and respect. This also feeds into the next learning objective of having a safe and non-stigmatizing environment to access health services or to have a safe place to stay. Number four is valuing the need for accessible health services. And five is understanding the principles of harm reduction. So next, in terms of our impact on the community partner, our work really eased the demand of Spark's workload. They do a lot over there, and it was really cool to see their work and collaboration amongst each other. And what our role really revolved around was increasing awareness of various health topics like the flu shot, COVID-19 vaccine, Hep C or a quick test. And we shared this information to not only Spark's target population, but also to the community that follows Spark on their social media page. And we maintain connections with local community organizations such as the Baltimore Harm Reduction Coalition and, like Sam said, Baltimore City Health Department.
30 seconds, Rennie.
Okay, thank you. And this was the first time that Spark was connected with COP. So Sam and I were able to make connections with Spark, their employees, with Katie, everyone there, and to create a bond to further build upon for future COP students and nursing students who are interested in volunteering. And lastly, I just want to thank our community partner and especially Katie for really opening their doors to us, welcoming great collaboration, and for also all the work they do, especially their flexibility in COVID times. And also for Jessica, Gabriella, and Reverend Vale, amazing work at Light the Truth as well. So thank you so much.
Awesome. Katie, did you want to say anything?
I did. I'll take any opportunity to thank Rennie and Sam again because they have been phenomenal this semester. I know everybody thinks that they have the best students placed with them, but we did have Rennie and Sam, so that's saying a lot. They helped us get through some backlogs, also plan for some stuff that we didn't know we were planning for, like especially a lot of things around COVID vaccination education. The flyer that Sam and Rennie, or a few of the flyers that Sam and Rennie made were not only used by Spark, but they became the official materials for distribution for the Baltimore City Health Department. They were also distributed at Baltimore Safe Haven, Baltimore Harm Reduction Coalition, Charm City Care Connection, basically within our network of harm reduction providers across the city. So it was great for Spark to have a little bit more working capacity with Rennie and Sam to be able to produce some of the educational materials that we always want to be able to produce, but they end up sort of last on the to-do list for us, but they're so important. This week we're hosting our first COVID vaccination event, and the documents that we'll be handing out to people will be created by Sam and Rennie. So their legacy with Spark will outlive them in terms of all the educational handouts and Instagram posts and things like that. They also made a really cool series on hepatitis C for Hepatitis C Awareness Month that will start next month. So it'll continue, like I said, outliving their time here, but we've been really grateful to partner with them. So,
fantastic. Awesome. We're glad this first Spark has been a source partner, but this is the first time with the community outreach program. So I want to just thank everybody for your exceptional work and love to hear that your materials are being shared widely. Well done. So we have two more posters to go. The next one is Suzanne's going to be talking about working with Squashwise.
Hello, everyone. I'm Suzanne. I partnered with Squashwise this, I guess it's been a year now, kind of crazy. So Squashwise is an organization that motivates student athletes, and it kind of pairs being a student athlete with academic potential. So they provide a lot of different services such as tutoring, college preparation, career development, mentoring, squash, and general fitness. I personally was the nutrition and healthy habits lead with the middle school team. So I taught students each week about nutrition topics, and we had a really fun time on Zoom together. So although we weren't able to be in person, I was very thankful that I was able to teach the students. I know some of the other COP students were kind of recording presentations and sending them in. So I was very thankful that I got to actually present to them. Some things that I learned myself is that being a teacher and presenting on Zoom to black screens is insanely challenging. And I had no idea that making PowerPoints takes so long. So those were some of my main takeaways just about the teaching experience. But I am glad that I got to practice my nursing skills. I think somebody else had mentioned that I got a really great opportunity to learn how to teach something in a very basic manner. And talking about nutrition is going to be important in many facets of my nursing career. So I thought that was really helpful that I learned how to teach people about nutrition in a really simple and effective way. Also just about being really involved in the community and creating diverse PowerPoints and having inclusion. I found that when I was looking for PowerPoint pictures, a lot of the things related to fitness were like thin white individuals, and the population of Squashwise athletes is not thin white individuals, as most of the population in America is not. So I thought that that was a really important thing that kind of thought about my learning and how I'm going to teach future patients. So on my impact on the community partner was that I taught lots of lessons to kids, and I hopefully taught them a lot of things. They were always really engaged in the lessons, which was really cool. I did set them up with nutrition materials that they can use for the future. So there are lessons there are PowerPoint slides for each lesson, as well as Kahoots. And currently I'm working on getting some summer camp stuff together for them so that they can have that for future use as well.
Great job. Thanks so much, Suzanne. Alexis, I see you're also on the call if you wanted to say anything.
Yes, we were just so excited to have Suzanne with us this year. Like she mentioned, we are an organization that tries to support student athletes, and nutrition is really important to fuel your brain and your body, which is, what we're trying to do for our kids. None of us have any background in health at all, so it was so great to have Suzanne make a lasting curriculum that we can use with our middle school students as they're learning, how to take control of their body. We now can equip them with all the info they need to make healthy choices for themselves and their families moving forward. So it's just been so great to have Suzanne with us. Honestly, we couldn't have made we couldn't have done it without her. We are so grateful and super excited for the summer camp materials that are coming up. So thank you again. Like other people have said, your work will outlast your time with us. We wish we could have you as long as we'll have your materials, but either's fine. Thank you so much.
Awesome. Thank you both, Alexis and Suzanne. So our last PowerPoint poster here is from the group that was working at the Wald Community Nursing Center and Outreach.
Hello, my name is Tony, and we have Emma here, and we're the COP students at Wald Community Nursing Center. And first, I wanted to briefly mention the wonderful and amazing Wald team members that we worked with throughout the semester. So we worked with Alexis, who was the team leader and the organizer. She just recently got her RN license, and she basically represents Wald to other community organizations and CCIS. Then we had Sherry and Chun Wan, who were the community health nurses who helped out with different activities. And we had Miss Kim, who helped out with logistics, email, and data collection. Briefly about Wald. Wald is a free nursing clinic operated by the School of Nursing. And some services provided by Wald include TV screening, Ask a Nurse, which someone mentioned earlier. There was a phone line service where members can call and ask any health-related questions. Wald also provide healthcare navigation, health education, and health promotion activities. As a COP students, we're really limited due to the COVID-19 restrictions and the pandemic, but some of our role included helping out with creating health educational materials. We also communicated and built partnerships with other organizations like Meals and Wheels. And then we also help to manage the Ask a Nurse hotline. And Emma will talk more in detail about all the other things that we did throughout the semester.
Next slide, please.
Hey everyone, I'm Emma. Tony already introduced me, but I also work with the Wall Community Nursing Center. And we specifically worked on Ask a Nurse, Meals on Wheels, and a lot of COVID-19 education materials. So we had Ask a Nurse. I know another organization mentioned it as well, but basically, community members can call, and it's a health navigation service. So if you call and say, "Hey, I don't have insurance, I need to get this checked out or whatever," we help with things like that, and we connect with other community health nurses. As Tony already mentioned, Alexis, Sherry, and Chunan were our community health nurses of the organization. We also work with Meals on Wheels. So that was a community partnership. We all attended the Meals on Wheels training to be trained to call clients every week, and you can choose how many clients that you want. But we just call and do regular client wellness calls. So just checking in. Hey, did you eat your food? Just establishing a really good relationship with community members in Baltimore. And then we prepare a lot of COVID-19 awareness materials. They're like small right here, but we developed a few, just talking about the vaccine, talking about, because there was a lot of pushback with people getting the vaccine. So that was a big thing when we first got back for the semesters, like how are we going to get people to get the vaccine? So that was something we really pushed, and I know it's been used among other organizations as well.
30
Um,
seconds, Emma.
yeah, and so I'll get into the student learning outcomes. So we just established good relationships with community members and also our team. We had a really good team, so it was really good for us to have a good um, relationship with everyone to figure out what we need to get done, and bounce off ideas, maintaining a comfortable space when we have our meetings, coming up with ways to reach community members, because in the midst of COVID, it's been hard. Obviously, everybody's been saying that the entire, it's hard to get people to attend things. It's hard to get people to open an email or even, so there was a lot that we had to work with as well. And then learning about the needs of the community from more of a virtual aspect. So that was those were our student learning outcomes. And then community partner impact, we just increased public awareness. I know that that was very helpful because community health nurses are, busy, and it's a lot to do. So I think we really did help with the simple, like something as simple as a flyer means a lot, because that's something, and a lot of preceptors mentioned that's something that y'all are going to use forever. So we did a lot of that, building relationship with community members, specifically with Meals on Wheels. That was an interesting way for us to get out into the community, and just call people and see how they're doing. And it means a lot. And then helping with the organization, planning upcoming events. And someone mentioned, but the virtual health fair was canceled, but we did work with that. We worked on communicating with people to get people to attend the virtual health fair and things like that. So that was our.
Awesome. Well, Emma and Tony, Chunan, who was on, had to jump off early for another meeting, but wanted to pass along that y'all did an amazing job, particularly with the awesome graphics and handouts that you made through social media. So wanted to pass that along, those comments and feedback as well. So kudos. Leah, I'm going to have you move on to our final slide here. And folks, this is where we're going to have this final opportunity to we're going to drop in the chat in a moment here a link where you'll be able to actually vote for which poster had the best description, which poster was the most artistic, and which poster was the fan favorite. So we'll get that going here just a moment. Leah will put up our poll. And while she's doing that quick adjustment, I just want to take another opportunity to say thank you and well done to everybody, not only for your posters today, but for all of your tremendous work in partnership with all of our awesome community partners here in Baltimore, whether you were, again, doing it all virtually. One of the things that Leah just dropped in the chat as well, so you see the link that you'll be able to go to separately, that pollev.com. With Leah Eckhoff 598, we'll do that. But we also put in a quick PDF of all the posters in case you don't remember from the very beginning. And for those of the COP students, if you have not yet completed your requested end date for COP, today is that deadline. Most of you have. I think maybe I have 3 or 4 that still need to do it. Leah, we're going to do the first vote here. So if y'all want to take a moment and go to that link, we're going to go live here to figure out who had the best overall description of the work that you did, and you can put in your response. I see the people are adding. We're ready to show responses. I think, well, I don't know if you can go back, but it looked like Esperanza Center was the winner there. Awesome. All right, let's go to the next one. We are going to see the most artistic. So again, new poll. We're gonna activate it if we can get it going here. Might already be active. See, this is the technology part. Here we go. We're gonna activate it. And now, folks, what do you think was the most artistic presentation? We had a lot of creativity with a lot of these posters. So please submit your votes. Can't tell if responses are coming in. All right, Free State Justice. Well done. Okay. Congrats, Free State Justice team. And last but certainly not least, the overall favorite presentation. Leah's going to activate this poll in just a second here. So what was your favorite overall? So, you know, their talking points, what they presented, how it looked, overall poster. Looks like, oh, look, we have a tie here between Jubilee Arts and Light of Truth. So congratulations to both Jubilee Arts and Light of Truth for your tremendous work. With that, Leah, you can stop sharing the screen. I'll just do in summation. Thank you, everyone. It has been certainly a privilege to work with all of you throughout the entire academic year. Some of you will be wrapping up by May 7th, which is the official end date based on the federal work study date. We will hopefully get back to everybody within the next 2 weeks. For those that are requesting to work a little bit longer, we have to figure out the budget projection. So there is an opportunity to potentially work a little bit longer. For anybody that hasn't filled out that quick survey about when you would want to end, if you wanted to go a little bit longer, you got to do it today so we can get this moving. Leah, anything else that you wanted to add?
I don't think so. Thanks everyone for your time. These great presentations. We really, really liked seeing what you were up to.
Y'all did a great job. Thanks for being here today, and we'll be in touch. Congratulations, everybody.